What we know about Omicron is that it is dramatically different in its outer shell from the Delta virus. And that has people concerned because we don't know how good the vaccines will work. We don't know how good one of the therapeutic options that we have, monoclonal antibodies, will work. So CORVAR-Seq is a program that was initiated by the North Carolina Assembly and is run through the NC Collaboratory and UNC Chapel Hill. It combines all the research universities in North Carolina who make their academic sequencing abilities available for public health surveillance. And so essentially, every positive sample in the state can be sequenced. It just needs to go to one of the hubs, which is UNC Chapel Hill, Duke, Wake, UNC Charlotte, and ECU. And sequencing is really the only way to find out what kind of variant is in a positive PCR sample. So far, the vast majority of samples have been Delta, but we expect Omicron to rapidly catch up and overtake Delta. Right now, that information is important for the Department of Health and Human Services, who can follow the pandemic in the state and make public health recommendations. It will help our clinicians to select the most effective therapy for each of the variants. But I want to stress that right now, all of the therapies still work and the vaccine still works. That is data that just came out. So the way that the variant detection works by sequencing is that part of the sample that you give in your nasal swab arrives at my lab. We isolate the viral nucleic acid, which is where the information is stored. And that viral nucleic acid is then put in a sequencer, which is a machine that determines exactly the genetic code of the virus. So it could actually be used on any virus, but we're using it right now for SARS-CoV-2. And then by reading that sequence, as it's called, we can determine how similar one virus is to the next. And we can determine whether the variant is Omicron, whether it is Delta, or whether it is an entirely new variant. When we get very few samples, like 10 at a time, we can turn the results around within 24, 48 hours. If we get 200 at a time, it might take a week. And part of the motivation for CORVAR-Seq is to generate the infrastructure within the academic centers in the state of North Carolina, so that regardless of how many samples we get, the turnaround time is less than a week. CORVAR-Seq is unique, and no other state other than North Carolina really has it. It brings together everyone on one table. It allows us to respond more quickly. Everyone in the CORVAR-Seq collaborative now knows each other. There are hotlines that really facilitate the rapid flow of information. And so whichever epidemic comes next, we now have an infrastructure in place across the entire state that the Department of Health and Human Services can call upon to really ramp up capacity as needed.